American hospitals are in a serious crisis, from large numbers of uninsured to spiraling costs, from outlandishly expensive prescription drugs to a severe and dangerous shortage of nurses. A shortage that can best be summed up by the fact that there are now over 120,000 open positions for registered nurses nationwide. If that sounds like just another statistic to you, think about this. Emergency rooms are shutting down, surgeries are delayed, and most disturbing of all, patients are sometimes not getting the critical care they desperately need. Something Joyce Thompson, a professor at the University of Pennsylvania School of Nursing, is acutely aware of. How worried should I be that if I go to the hospital and I push that little button for the nurse because I'm really sick, that she may not show up for a half hour?
I think you should be worried.
Is this a crisis?
Yes.
A Harvard-Vanderbilt study of thousands of hospital records confirms a direct link between a lack of nurses and patient complications that can result in death.
I mean, hospitals aren't run by physicians. Hospitals are only successful if nurses are there. A physician can cut you up. He can put you back together. But if you don't have that nurse who's following up, who's helping you to understand what is the impact of this particular condition on you, then the hospital falls apart.
Hospitals have struggled to attract more nurses, but working conditions keep getting tougher. They frequently have to work double shifts, and new insurance rules under which only the sickest people are treated in hospitals these days mean that the patients require much more care and attention.
It's Laurel, can I help you?
Nurses like Laura LeClaire say the pace has become relentless.
It's a lot of work. It's very stressful. We're not shuffling papers. These are patients' lives. I mean, and we make one little mistake and it could harm the patient.
Is the pressure infinitely more than it used to be?
Absolutely, absolutely. Give me a second.
We found Laurel working a 12-hour shift on the cardiac floor at New York's Montefiore Hospital.
Listen, we have a problem up here. Dialysis needs to have the blood right away. And needless to say, there's nobody here to send down on 8 North or 8 South.
Do you have a minute to tell us what's happening?
We need blood, actually, for a patient.
Laurel's patient has to get the blood at a specific time, and it's already late. Because of the staff shortage, she has to find someone to bring it to the floor ASAP.
I'll call and find out if it left yet, all right? I'll say it again.
They're supposed to send it.
I promise.
Did you get the blood?
Yeah, we got it taken care of. I just have to let her know.
Even though the work has become more difficult for Laurel and so many nurses, wages have not even kept up with the cost of living. Do you feel that your salary
is reflective of my education and longevity? No.
And experience now?
No, absolutely not. With my longevity in another position, I would be making much more money.
This is a major reason for the shortage. Ever since the mid-'80s, young people have been choosing more lucrative careers. At the same time, the nurses we do have are getting older. The average age is now 45. Just as the baby boomers are starting to need more care, the pipeline is running dry, and it's going to get much, much worse. I've read that over the next 20 years, this country is going to be short 400,000 nurses.
That's correct, unless we do something about it now.
She says we have to make nursing a more appealing choice.
Because the fact is that the societal image is anybody can be a nurse. It's like anybody can be a teacher. That's wrong, extremely wrong.
So it's a great profession, but out there that's not what young people think.
That's right.
They think it's drudge work.
Well, and families think that.
Hospitals have been slow to respond, and so has the government. State legislatures have only recently begun trying to restrict the number of hours nurses are required to work and increase the number of nurses on each shift. And there are proposals for scholarship money and student loans, but everything has a price tag.
We have the solutions in this country. We have to have the political will to put the solutions in place.
She's dismayed that instead of spending more to attract the number of nurses we need, we are turning outward. We have begun hiring nurses from overseas.
Our job is to find nurses and bring them into the United States.
Armin Shakaro runs Core Medical, a nurse recruitment company. More and more hospitals are hiring staffing companies like his to find qualified nurses from English-speaking countries like Ireland, India, and the Philippines.
This is going to be the package that's going to be handed to the nurses.
But now, CORE and other companies are targeting some of the poorest countries in the world, like South Africa, where they're having their own shortage. We followed CORE to South Africa as they launched a controversial drive to take nurses from their hospitals and put them to work in ours.
The package that we're offering is really a great package. And
Nicola Hopkins is a recruiter for CORE. She's making the hard sell to a group of nurses in Johannesburg.
We have positions in Arizona, California, in Florida, Georgia, wherever you're wanting to go.
Hopkins used to be a nurse herself in South Africa until she was recruited to work in the States. She understands how little these women earn. An average South African nurse makes about $5,000 to $7,000 a year. CORE offers them 5 times that.
Roughly $20 an hour at least.
And a package of incentives that these overworked South African nurses are finding hard to turn down.
Automatically for families, we will be sponsoring you for your green cards because this then entitles husbands to come through with you.
Which prompted one man to ask about housing.
What's the process of accommodation? You start in an apartment like a flat.
We will help you find an apartment.
The pitch is, pack your bags, we'll do the rest. As long as the nurse agrees to work in an American hospital for 2 years, CORE will offer everything, from an airline ticket to a green card.
We encourage you to bring your family because we want you to come across as a family unit to support one another.
The reason South African nurses are in demand is that they are so highly trained. Because doctors are scarce here, nurses have become more experienced at treating and diagnosing patients. CORE vets these nurses with reference checks, a battery of credential screenings, and tests in English.
And that is really what we're looking for, a well-established and well-documented record of competence in an acute care setting.
Hasina Subadar, head of the South African Nursing Council, is appalled that the United States is trying to poach their nurses, and she's trying to stop it. Can you blame the nurses who say, yes, given these inducements, given the money?
No, I don't blame the nurses. I think that everybody wants to improve their standard of living. I do, however, blame the recruiters or the first world countries. And I feel our country is at a stage where we're trying to recover from a very, very difficult past. And by taking our human resources, you are taking away our future. You are taking away our ability to improve the quality of life of people. And I think that this is something I would like to say to American society. Think about it.
South Africa's health system is stretched to the breaking point. Hospital waiting rooms are overflowing, partly because the country is now in the throes of a catastrophic AIDS crisis, with the highest number of cases in the world. According to the United Nations AIDS program, an estimated 1 in 5 adults is infected with HIV. As your AIDS crisis deepens, do you see that there are more people coming over to get your nurses out of here?
Yes, definitely.
And while America has just begun its active recruitment here, other countries such as Saudi Arabia, Australia, and especially England have already lured thousands of nurses away to alleviate their own shortages.
Each country that has a crisis, you need to deal with it within your country. Don't see your solutions as coming to our country and resolving your problems.
What scalds her is that the recruiters are going after the nurses they can least afford to lose.
The people that we are losing and the people that are being recruited are the experienced and the skilled nurses.
The cream of the crop.
The cream of the crop.
There may not be a more dramatic example of that siphoning off of the cream of the crop than what's happening at South Africa's Cecilia Makawane Hospital. It sits on a hillside in the midst of a sprawling and very poor township. Inside, Lulama Galeba, Deputy Director of Nursing, wanted to show us what she's up against. You have lost almost half the nurses in this hospital?
I'm telling you.
Foreign recruiters have come here to lure away the best and the brightest.
How small that baby is.
One of the best of all is Patricia Mayaba, who worked her way up to supervisor of pediatrics. She has just given notice after 20 years on the job. Why are you leaving?
Because of financial problems.
You're leaving mainly because of the money?
I'm living because of the money, and I've got 4 kids.
With all her experience caring for children, she doesn't earn enough money to feed her own. Your own children are hungry. Your
Own children are hungry.
Her leaving will make what's already a desperate situation at the hospital even worse. What is the ratio of nurses to patients on this ward, in the pediatrics ward?
We've got about 1:10 babies.
1 nurse for 10 patients.
Yes, sure.
And it's supposed to be 1 to 2.
Yeah.
This one? Is this empty? Some wards have had to shut down completely. These rooms should be filled with AIDS patients.
All of them are empty, actually.
All of them are empty?
Yeah. This ward is shut down because we don't have staff.
Do you have any guilt about taking nurses away from South Africa that needs nurses, maybe even more than we do?
No, I wouldn't say I have guilt, because if I don't help them and bring them across with a company that's going to keep them happy, they're going to go somewhere else. So no, I don't feel guilty, because if they want a better life, I'd like to try and offer it if I can.
But Professor Joyce Thompson is greatly disturbed by the foreign recruitments.
It's extremely unethical.
Unethical. Explain that.
It's such an egotistical, parochial view that in the United States, we can buy anything that exists in the world to make ourselves better. And let's not be concerned about poor Africa. Why shouldn't we be concerned? We're a part of this world.
Is it selfish of us? Is it right of us to go over there thinking, we have a problem, we'll go over and take what we want?
Yeah, and I'm sure there are people there that see it that way. But again, I don't think that's an issue that we can afford to allow to slow us down in this process. We have a very fragile healthcare system that we're trying to keep intact. And nurses play a large role in that. They're the single largest population in healthcare. We really cannot get along without them, and I think we're going to find that the effects of not having nurses is going to be quite devastating. So I really don't feel like we can look at a problem like that and allow it to stop us.
Since we first aired this story, the problem has gotten even worse. At the end of October, a new study from the University of Pennsylvania showed that for the first time, there's a direct link between the nursing shortage and an increase of patient deaths.
I love you, yes I do, with all my heart and soul. I need you, yes I do, don't let my love go cold. Squeeze me tight, hold me right, make me know you're mine. I love you, yes I do, with all my heart and soul. I need you, yes I do, don't let my love go cold. Squeeze me tight, hold me right, make me know you're mine. I love you, yes I do, with all my heart and soul. I need you, yes I do, don't let my love go cold. Squeeze me tight, hold me right, make me know you're mine. I love you, yes I do, with all my heart and soul. I need you, yes I do, don't let my love go cold. Squeeze me tight, hold